Worked in mental health for about 15 years, ran programs in Portland, and I had the same experiences. Now they were a little bit farther back than probably Joel's, so my sense is it's gotten a little better than when I was there, but I can tell you about people with mental illness getting off the bus from Texas and with a one-way ticket from the government of Texas saying go to Maine because it's easy to get benefits there. I think it's gotten better than that, but that was my experience. And I would just add to that, I guess, that we always think about, well, is this fair, is this fair? When we expand the system and people get it when perhaps they don't necessarily need it, they're taking from people that really do need it. They're hurting, not hurting, but there's a finite number of money in the system, and people that are taking it, people that really may need it, aren't necessarily going to get what they need. So I think it's a concern for me.
Well, one of the things that's happening in Maine is that we have several pilot programs going on to try to rein in those kinds of abuses. And I think that, we say things anecdotally that where it happens once or twice or something like that, and then it gets to be a story out of control. Like I would bet that there aren't a lot of people showing up with a hangnail. There might be one person that showed up with a hangnail or a diaper rash, and then it gets to be a story blown out of control. It is difficult. Nothing is easy, and people have to qualify to be able to get public assistance. They have to have some kind of reason. If you're a single man without children, you either have to be disabled or have some reason to be able to get some SSI or Medicare or whatever. And I know that there are some disabled adults that are getting some main care, and they may not have any other benefit. We are working very hard, the department is working very hard. We know that we don't have enough money. We know that it's not sustainable for it to work the way it is. But the federal government has regulations that require us to do a lot of work, a lot of groundwork, before we can change certain regulations here in Maine. And the department is doing a lot of work at the moment, doing various kinds of pilot programs in hospitals as well as private doc agencies to set the groundwork for us to make some changes in the welfare system and the public assistance system.
I'd like to take an opportunity to respond to my colleague. With all due respect to the Senator, I use the anecdotal story of a hangnail to represent many stories. And I can share with you two things. Number one, I see people literally every day and every night in the emergency department setting who do not need emergent services, who may need some type of care. But again, people who do not have respect for the value of the system and abuse the system in the way that they come and have a $500 emergency room visit rather than seeing the appropriate care provider that would have been a $70 or $80 visit. They are not all hangnails, it's true, but they are visits that don't necessarily need my services at 3 o'clock in the morning. The second thing I will add to that is that I have seen countless patients who tell me very directly that they came to Maine because I will ask them, you have an address that's in Massachusetts or in Florida. What are you doing in Maine? Well, I'm here for the benefits. Absolutely here for services. And that's part of the culture that we have to stop. And if we can't acknowledge that that culture exists, then there's a problem. We have to be able to have a candid discussion together. And this is together, because no matter who wins in 12 days, we're going to have people from all spectrums of political party, and we need to be able to at least agree on some of this so we can have a legitimate discussion to move forward.
If I can build on that a little bit. First, I agree with the purpose that has been stated before. I think that there are people in society who sometimes at some points in their life need a safety net, and that's what these programs that we're talking about should be there for. Those of us who win in 12 days are going to be going to Augusta and playing a small part in spending our money as a society, as a taxpayer, and we need to be always aware of that. That is a very high burden, and one that we all need to take very carefully. We can't make decisions based on anecdote. We have to use data. We have to understand what's happening. And yes, go to the frontline service providers, but make sure that we're making decisions based on what's happening everywhere across the state, not on one person's experience or on one particularly compelling story. So if we look at the data, first in terms of benefits, it's been mentioned before, if we use just TANF as an example, and there are others as well, the 5 New England states, Maine has the lowest, significant, the lowest benefit. So is that attracting people? Look at the data. 4 times more people leave Maine on assistance than come to Maine and receive assistance, 4 times. Is there fraud and abuse? Absolutely. Any large organization has inefficiencies. So what is it? Well, there are people there at this division who they go back and audit. And they audit and make sure that people deserve the care that they're getting and they're using it appropriately. Across the country, it's about 2 or 3%. In Maine, it's 0.2%. So that means in Maine, if you get 1,000 people together, 2 or 3 people are misusing the benefit. This is about values. And this is not just about values that are decided in Augusta. We all have a responsibility. I've heard anecdotes since I've been there, but nobody, and I've always come and said, if you have a specific case, please bring it to me, because it is your money. We need to have specifics, and any of you that come across specific cases, contact any of us, because we need, any verifiable fraud needs to be stopped.
I'm going to disagree with my good buddy here. I visit every house. It's the biggest complaint I get. Probably some of it's true, some of it's not true, okay? But when you hear it time after time, some of it's got to be true. I think what the problem is, you hear things from the top of the department, and I think a lot of it's what they want us to hear. But if you talk to caseworkers, and I've talked to several, they tell me a different story. Too easy to get, not enough restrictions, they stay on it too long. These are from caseworkers. Then I bring that up to somebody up the top, say, oh, you're talking to a disgruntled worker. But I get this caseworker after caseworker after caseworker. We've been told 1% fraud. I heard that 3 years up there. There happens to be, I think, 10 or 12 people in that department, and I've been told there's only 6 that are out in the field checking for the whole state of Maine. One of them happened to live in Turner. I talked to her husband, and he told me, his wife said, no, it's more like 25, 30%, not 1%. Finally, I heard the commissioner last year for the first time say, 1% is what we're catching. Big difference for what's out there and what they're catching. So I know, I kind of break with my party here, but something has to happen. I agree with the good doctor. I talked to emergency room people. It's being abused. I've talked to pharmacists. They're supposed to pay $1.50 copay on their medicine. They don't pay it. Well, I've got one of the best insurances you can have, but I have to pay a copay. If I go to the emergency room and I don't stay overnight, I got to pay a copay. They don't have to do any of this, so there's, as he said, it's culture. There's no onus on it. We've got to change some of that stuff because it's bankrupting us. 30% of our budget goes there. That's too much. So I know I differ from my colleagues, but I'm getting this all the time. So.
Yeah, that was kind of what I was going to say. I agree with Mike. He mentioned values. I think that's the important thing for all of us. The thing that just stirred me up a little bit was a few people have said anecdotal incidents, and for me, it's called life. I've been in emergency rooms with people. When I worked in mental health, I know of clients that came and said that, boy, it's really nice to be in your program. So I went to my doctor and I got a note, and now I'm disabled and I don't have to go to work anymore. And I think your idea is good. I should bring that up. And for me, it was a long time ago, but that's a good suggestion. Just start bringing that stuff up to people.
I just wanted to add that education is important in the welfare system also, and I think it's very important for Maine Care because I think these people need to be educated on how to take care of themselves, and we need to have them in wellness programs. Many of us, I know the legislature, we're all in wellness programs, and we're on the legislature's health care program. We have to be, what we say, 5% if we're in a wellness program. I think main care recipients should also be in a wellness program, and they should be held to that. They should have primary care physicians. They shouldn't be going to the ER for a hangnail or whatever else they're going for. And so that's very important also.
Thank you. I guess Representative Dostie sort of covered what I was going to say for the most part, but I think, you know, the question here is, are there people who need assistance? Yes. Are some people staying on longer than they should and cheating? Yes. What can we do to find those people and move them out of the system? We have too many people who are disabled. We need to figure out what is it we can do differently in the way we deliver services to people who are considered disabled to help them become able. Because there are people who can work with all manner of handicaps and disabilities, and there are too many people who are happy to stay home sometimes and continue living in a lifestyle that is disabling to them, and that costs all of us, and more importantly, it costs them the opportunity to have a real meaningful life. So we need to look at these issues coldly and hardly. I put in a bill for residency requirements because I didn't know they were unconstitutional. I was immediately contacted by the department to let me know that they were unconstitutional, and they sent me those Supreme Court decisions, so I didn't sign my bill because I didn't want to waste the taxpayers' money moving forward. But I have been in contact with our state auditor. We've allowed her to have a confidential hotline so that people who see waste, fraud, and abuse in government can call and report it. So when she gets calls, she can report those over to the department. I've also been in contact with the Attorney General to say, you know, maybe you could also partner with the auditor to investigate these matters, because every penny that's wasted, you know, by someone who's stealing makes it that much harder for the person who actually needs help to get it, because people resent it. It's infuriating to people who are working every day to see someone who's living with their boyfriend, not claiming their income, getting a brand new TV, all these things, you know, we see out in our communities. Those are difficult, but there are people who really do need help, and we have an obligation in government to help them if they are truly needy.
Okay, we don't have any time for any more questions tonight.
I wanted to say that Andrew has been recording this session, and if any of you want a copy of that, if you could give us your email at the registration desk, and we will email you a copy of tonight's presentation. I should also add that this is a class that is also online. LIC is using the new technology. We have students all over Maine, all over the Androscoggin Valley, as well as in Sudan and Iowa, who are taking this class. So they can find out what's going on locally in Maine. But thank you all very much for being here tonight.